Good morning to everybody, and first and foremost to all the nurses and everyone out there, thank you for what you're doing. To everyone that has to come to work every day, everyone that keeps government and private sector moving, thank you, thank you, thank you. But sadly enough, we've lost 2 more Albany County residents last night. 2 men, one in his 80s, another in his 90s, both with underlying health conditions. One was a resident at Shaker Place, our nursing home, and the other gentleman was not. That brings our total up to 58. My heart condolences goes out to the families, and again, through these difficult times of trying to do this type of service when you really can't do wakes and funerals like we used to. So again, if everyone just gives a little prayer, a little condolence for these families, I appreciate it. And to the other 56 families. It's a tough time for everyone. As of today, we have 1,309 positive cases of the coronavirus. It's up 32. So our trend's been pretty good for the last 6-7 days, you know, hovering around 20 people a day, which is good. 1,009 people under mandatory quarantine. That's down 38 from yesterday, which is good. And 15 people under precautionary quarantine, which is up 10 from yesterday. Shaker Place has a total of 58 residents who have tested positive now, including 2 who have recovered. 18 employees have tested positive, remain out of work, while 9 others have fully recovered and that are back to work. We have 2,979 people that have completed quarantine, which is up 85 from yesterday, and we have 768 who tested positive for the virus and have recovered. That's up 15 from yesterday. And remember, yesterday we had 89. So that's all good stuff. And you know, again, we probably hit the apex. We're going down, which is good, which helps us start to reopen. The other thing, though, we got to keep looking at is people passing away, which affects everything too. So we're watching everything as we move forward. There are now 29 people hospitalized with a hospitalization rate of 2.21. And currently we have 6 people in the ICU. That's down 1 from yesterday, which is also good. So, you know, as we ramp up testing here and we continue to move forward in all the surrounding counties, you know, it's good to see that the numbers are kind of staying low, which is good. Doesn't mean it's not going, people. Doesn't mean that it's not here, and Dr. Whalen will talk about that, but it's here. You know, it's just good that people are doing what we've asked 8 weeks ago, a little over 8 weeks ago now, to stay home, social distance, wear a mask, clean your hands, cough into your arm. Again, if you need to set up mobile testing, the number is 518-465-4771, 465-4771. As always, if you want to do the drive-through, Rite Aid, just go on to riteaid.com, set up your appointment. Albany's still up and running too, so they're got traffic going through there, so you can still go through Albany, which we recommend. We have our urgent care going on, so and hopefully in the next couple of days we're going to announce different type of testing going forward, and we're trying to work that out. But I do want to say to everyone, thank you that are staying home, who are social isolating, and doing what we need to continue to move forward in trying to reopen up. And one of the key elements is going to be our health department, led by Dr. Whalen and her team there, that have done a great job on this, but most importantly, who continue on work on other things. I know everyone thinks that this is the whole world. They have a variety of stuff that they work on day in and day out, and this is a piece of the puzzle for them, but there's other things they're constantly working on. But Dr. Whalen.
Thank you, County Executive McCoy. So I wanted to share with everyone that we did receive word overnight that the testing site at SUNY is going to be looking to expand their test criteria. They're looking to catch a much broader net of people that need to be screened or tested for COVID-19. As we talk more and more about how we reopen, one of the main strategies that we have to employ is the continued and widespread testing so that we can identify cases early and ensure that those individuals are under home isolation and that we contact trace their their contacts and quarantine them until they're beyond their incubation period. We've been doing this since day one, but now with a broader testing, it enables us to diagnose people that are asymptomatic. So I'll be sharing this flyer that we received on our website later today, but wanted to ensure that I read some of the categories of workers out that should be tested. These include healthcare workers, first responders, any position within a nursing home, long-term care facility, other congregate setting, included but not limited to correction, parole, probation officers, direct care providers, firefighters, healthcare practitioners, professional aides and support staff, medical specialists, nutritionists and dietitians, occupational, physical, recreational, speech therapists, paramedics, emergency medical technicians, police officers, psychologists, psychiatrists, residential care program managers, and also includes individuals who are employed as essential employees who are directly interacting with the public while working. This is a very broad categorization of workers and includes animal care workers, automotive service and repair workers, bank tellers, building code enforcement officers, child care workers, client-facing case managers and coordinators, counselors in mental health, addiction, youth, vocational, etc., delivery workers, dentists and dental hygienists, essential construction workers, faith-based leaders, field investigators for health and safety, food service workers, funeral home workers, hotel motel workers, human service providers, laundry and dry cleaner workers, mail and shipping workers, maintenance and janitorial cleaning workers, optometrists, opticians and support staff, retail workers at essential businesses, such as grocery stores, pharmacies, convenience stores, gas stations, and hardware stores, security guards and personnel, shelter workers and homeless support staff, social workers, teachers, professors and educators, transit workers, trash and recycling workers, and utility workers. So all of these essential workers can make an appointment to be tested at the SUNY site, and the hotline is, as it's always been, 1-888-364-3065, or online at covid19screening.health.ny.gov. The Albany testing site is available to take your call and make your appointment. Screening and getting more information on those that may have asymptomatic infection or low-grade infection is going to be essential in any effort to reopen. We need to rapidly identify people that have COVID-19 and make sure that they're not spreading it to others, and the best way to do this is through screening and contact tracing. So I'm happy that we are able to let you know that this will be done. We continue to work very closely as well with our nursing home partners to ensure that they are getting screening of all of their patients and their workers, and we're working very closely on that. I know the county executive has been advocating for this, and the state has been conducting a number of calls in the past couple of days, and we'll be looking to roll that out next week as well. So this broadening of the test base is going to be an essential part of going forward, in conjunction with the measures that we continue to discuss on a daily basis, including social distancing, hand hygiene, and wearing masks.
Thank you, Dr. Whalen, as always, in the update. And actually, we were on a phone call with Larry Schwartz at 10 o'clock today, and they were talking about the tracing and how the state's going to handle it and roll it out. One of the suggestions I made yesterday, and actually talking to the mayors and supervisors, and I talked to Sheriff Apple yesterday, we're going to need roughly 90 people a month to go out there and do these tests. And then, don't hold me to that math directly, but it's roughly around 90 people. And I said, well, how many EMS personnel do we have in the Sheriff's Department? How many EMS we have throughout the county? How many fire departments? How many volunteer departments? And maybe this is something we can task going into the future, because how do you do this and maintain it? The state's going to pay for it, great. If not, we have to be creative and ship it around the county to make sure it happens and help out other counties that fall short. So a lot of great things were discussed at 10 o'clock, and look forward to figuring that out so we can move forward. But things in government don't stop. In our Department of Children, Youth, and Family, continue to go out every day into our community. There's things mandated by law they have to do. There's other things that they continue to do, and we have to work with them to make sure that they do it in a safe manner now. Things are a little bit different, and you can talk about that, but Maura Manning, who is our commissioner at DCYF, this month is National Foster Care Month, and fostering for parents and for children that are out there that obviously are in a situation that they need to have someone to either adopt them or to take them in as a foster child. And we're recommending to anyone out there that would like to try that, you can go to our website and you can sign up to do that. And there's a process, and Maura can talk about that, but it's just not the only thing that they handle. They got so many things that that whole unit does, and Maura, who better than you to talk about it? So
Thank you
please.
very much, County Executive McCoy. It is National Foster Care Awareness Month, and this month they have a specific theme. Foster care is a support to families, not a substitute for parents. And I think that's really key, that we really want to engage the families of foster care children. They need to be involved in the permanency planning of their child. We find it much more successful if the child and parent remain in contact. So one thing we've done in the department is have a parent-to-parent meeting. Parent-to-parent is bringing in the foster parent and the biological parent and discussing that child's needs to identify such things as, what do they like to eat? Do they have a favorite stuffed animal that they like to sleep with? And of course, cultural practices. We find that this helps that transition to foster care and really enhances the relationship between the foster parent and the parent. The other thing we do is support the family by wrapping around community services and supports so we can facilitate a reunification sooner rather than having the child stay in foster care. I also want to say that we really thank all of the relative caregivers that are taking care of the children in what we call a kinship care placement. They are key in really keeping the child in their own community. So we applaud them and thank them. Foster parent and kinship parents really play a critical role in this temporary, safe, and nurturing environment. They are essential for these children, and we really have seen really positive outcomes with that. Currently, we have 139 children that are in a foster care placement with a foster parent. 33 of those placements are with Albany County certified foster parents. 16 are with relative caregivers, and the remaining 90 are with foster families through our voluntary agencies, which include Berkshire Farms, Northern Rivers, and St. Catherine's Center for Children. The department also really happy to say that last year we had 58 children, foster care children, adopted through Albany County Family Court. We really stay focused on ensuring the safety of these children and getting to permanency as soon and as possible and have a stable environment for these children. And as Mr. McCoy said, we really, if you can open your heart and open your home, we would love for you to become a foster parent. It's very rewarding. And please contact our office. We have an adoption home finders unit, and their number is 518-447-7515. Thank you.
Maura, thank you to you and your staff that do unbelievable job day in and day out, 7 days a week. Regardless going on, your office is open 7 days a week, 24 hours a day. Mm-hmm. And thank you for protecting our children and what you do in the community. Thank you so much. I also want to remind people about the census. I know, it's something no one's really thinking about sometimes, but we need to have people fill it out. You're home. I gave you a homework assignment. It didn't work out. Let me try it again. Maybe I have to get a principal on here to talk about this. Please, take the time. takes less than 5 minutes, and there's so much that's at stake. Over $243 billion could affect us here at a time when we're all looking, the county executives, mayors, supervisors, all calling on the federal government for more money. This is how you can help us. Fill out your census, get counted, so we can get this money coming in, and also affects our representation in Congress. So if we don't have the numbers in New York State, guess what? We're going to lose more seats in Congress. That means less money coming back, and I think Governor Cuomo did a phenomenal job pointing out how if you're in power, Kentucky gets, I think, $39 billion more than it gives in. Florida gets like $28 billion more than it gives in, but not in New York. And there were great points the governor made. The only way you're going to change that, people, get counted, so we can get our fair say at the table. So please do that. Also, we've been responding to our neighbors. I have a leaders meeting this afternoon after talking to all the mayors and supervisors yesterday in Albany County. I'll be meeting with my counterpart, or not meeting with them, I should say that. I have to correct that. I'll be talking to them on the phone in Zoom to basically to discuss going forward how we're going to do this regional approach. And you're going to get more stuff out of us going forward. I've been working with New York State Association of Counties, other county executives across the state, and obviously across the nation of how everyone's going to try to do this going forward. It's going to be a slow process, so bear with us. We're going to try to get there to meet all the 7 steps that the governor put out through the CDC to make sure that we do this in a safe manner, because the safety of the residents, first and foremost, are my main concern. And then, trying to establish the small businesses and everything else going forward and helping people out that need it to get back on their feet. So, which is good. Some of the other things I want to say, I want to highlight is our probation staff who have been helping out with the Department of Health with the quarantine checks. Thank you to the probation department. They've really stepped up with our DPW. I can't thank you enough. Also today, I just found out Father Young from the Altamont program at 45 South Ferry Street in the south end of Albany is doing a food giveaway today between 10 a.m. and 2. If you noticed the one at the airport yesterday, led by Phil Calderon, our CEO out there, and the Airport Authority Board, did a great job, and the line was unbelievable amount of people coming for food. So people need it, and we have to do it in a strategic way that we're all working together. I think it's great. Feed Albany, the Boys and Girls Club, all the school districts trying to feed the children at home, but we kind of got to coordinate and get the food where it needs to get to, and make sure that the people that have been devastated by the coronavirus, that lost their jobs, and seniors over 70 that can't get out, make sure they get their food and make sure we get the children fed, which is so important. So thank you to everyone doing that. Can't say enough thank yous to everybody. Also, we have a picture from outside our Albany County Department of Health, a 518 Human Rainbow in honor of National Nurse Week, so thank you for that. And as always, if you need to ask a question, you're having anxiety or whatever your issue may be, please. It's available 7 days a week from 8 a.m. to 8 p.m. The number, as always, is 518-269-6634. And our sexual assault hotline number, area code 518-447-7716. And as always, the other numbers that we always put up, please utilize the numbers. Again, don't feel that you can't call the mental health hotline if you have an issue. Because listen, that's what they're there for. They're there to answer your questions and help you through this. Because again, like I said, it's a marathon, it's not a sprint, and we all need to readjust to what the new norm's going to be. Thank you.